Good morning and thank you for watching MMR Student News. My name is Brittany and this is Barbara. We're here today to tell you about 2 new medications on the market. Barbara's going to start today with oxygen.
Good morning. Today I'm going to talk about oxygen therapy in the pre-hospital setting. Oxygen is an essential element used for human survival. It's a gas. What oxygen does is it increases our blood oxygen levels. We give O2 usually for patients with difficulty breathing or with a SpO2 sat of less than 94%. Let's see. What we do is we treat, and it prevents hypoxemia, which is low oxygen in the blood. And you can use this a couple different ways. There's a mask called a nasal cannula, and you put that on for 2 to 6 liters a minute, and you can adjust that with the oxygen tank. There's a non-rebreather mask that is 10 to 15 liters per minute, and then there's a bag valve mask. There's a couple of different other ways, we'll get to that later. Some contraindications are generally in the pre-hospital setting with a newborn. High concentrations can cause ocular damage, and they delay the alveolar septation and bronchopulmonary dysphagia. To use our drugs, it's an inhalation, so you have to inhale that with a mask or a nasal cannula. You can also use a CPAP, which is really high flow oxygen, and it can be used in a nebulizer as well. Some side effects are skin irritation, nasal dryness, and oxygen toxicity.
And now over to David, who's going to show us how to use a couple of these devices.
Non-rebreather on the face. Pinch nose, pull straps, good seal. All right, nasal cannula. Prong is go inside the nose, wrap around the ears, tighten up. This is 2 to 6 liters per minute. This is a single rescuer BVM. So you seal C and E, pull up, and ventilate every 5 to 6 seconds.
Alright, so for 2 rescuer, I'll use one of you will seal and hold. The other one will ventilate.
Again for every 5 to 6 seconds.
Thanks, David. Now we're going to head back over to Brittany here, and she's going to talk about albuterol.
Thanks, Barbara. So today we'll also be talking about albuterol, which is used for asthma patients. It dilates bronchioles by relaxing the smooth muscles. You use this to treat bronchospasm or narrowing of an airway in asthma or COPD. You should not use albuterol if your pulse is greater than 150 beats per minute in adults or greater than 200 beats per minute in peds. You will use this drug by inhaling it or nebulizing it. The only side effects of this is trembling, tachycardia, cough, dysphagia, wheezing, and dizziness. Now back to David, who's going to show us how to use this.
This is albuterol administration to a patient. So you insert the albuterol in the little chamber here. Close it, hook it up, turn it on, don't break it. And then you insert in the mouth, have the patient take some breaths.
Thank you for tuning in to MMR Student News. We hope you learned something new today. See y'all next week.